Monday, February 10th. Can I have a roll call, please?
Commissioner Mandel.
Present.
Commissioner Grimmick. Commissioner Osei.
Present.
Commissioner Avila. Present. Commissioner Estradas.
Present.
Commissioner Griffin. Commissioner Hisarick.
Here.
Commissioner Cato.
President Cato.
Commissioner Kalfani is absent. Commissioner Shannon and Commissioner Sirota. We have a quorum.
Thank you. Can I have ask for approval of the minutes from January 13th that was sent out to everybody?
I'll move to approve.
Second.
Any discussion? Seeing none, all in favor?
Aye.
Aye.
Anybody opposed? They're approved. Neighborhood council, anybody from the neighborhood council here? Seeing none, moving on. Public comment, anybody with public comment? Seeing none, item number 1. Lauren, you're up.
Public comment would now be closed, Mr. President.
Yes, it would be.
Thank you.
Thank you. Commissioner Grimmig is here.
Hello, everyone. I'm here to give an update on the Los Angeles City Health Commission report for 2020. I would like to go over first the major changes that were updated in the report, which should be in front of you. The last month, we have been changing the EMS system, which is in the 3rd section of the report, and this section was changed to emphasize on the Los Angeles Fire Department system of care, which focuses on accurate dispatches to appropriate alternative destinations, such as mental health care centers and sobering centers that were mentioned in many of the presentations at the Commission. Another change in the report was the expansion of response programs. That is located on page 24 of the packet. There are 2 new recommendations added. The first one is located in the recommendation number 4, which is the increase in the number of psychiatric beds in public hospitals. And this was based off of Mr. Garcia's presentation last meeting from the California Hospital Association. His presentation informed us on the lack of beds. Right now, Los Angeles lacks especially beds in the psychiatric department, and so our recommendation to increase beds in that sector is very prevalent. The next recommendation is under the recommendation number 5, and that is to encourage the use of the Los Angeles Network for Enhanced Services, otherwise called LANES, to allow healthcare providers safe access to patient information. This recommendation was given by Commissioner Estradas, and it was to encourage the use of LANES. This recommendation is highly needed because it serves as an electronic health record system that can update, access, and share medical records of Medi-Cal patients as well as uninsured patients. And this could serve as an effective tool for the EMS department specifically. There is a new subsection going on to page 25. This section is called the expansion of county hospitals and funding. The recommendations that were added were based off of new events in the city. The first recommendation being to urge the LA County to purchase and acquire St. Vincent Medical Center into the LA County health system. For background, the St. Vincent Medical Center was recently filed bankruptcy and is planning to close soon. However, we believe that we want to have an adequate provision of health services as well as an adequate provision of hospitals in Los Angeles and believe that the acquisition of this hospital would be beneficial to the city. The second recommendation is the increase of Medi-Cal reimbursements to all providers, including hospitals and medical centers. We believe that this is fundamental because of the recent closures of hospitals that are listed in that subsection. Having more reimbursements may allow hospitals to continue their services and may prevent further bankruptcies of other hospitals. There are other small changes within the report, but a couple of commissioners had emailed me or called me regarding changes that need to be still made within the last 2 days. So I thank you all the commissioners who had given me that advice, and I plan to change that in the upcoming final draft. But a few topics that were brought to light to discuss today was the change in the cover from 2019 to 2020 instead of 2020. So currently right now, the cover says 2020, so this would be a slight change. The second recommendation was to add a section on the coronavirus, as it is a very prevalent issue right now, and we would add a subsection under subsection under the communicable disease response page on page 26. So we would add a section on coronavirus. And then if all the commissioners could turn to page 33, it is blank, and that is the current objectives. In the previous report, we had made a list of objectives that we want the commission to tackle in the next upcoming years. And today, I think a good discussion on the next objectives for the future report would be good to discuss. And on the following page, on page 34, there's the conclusion of the report. And one of the commissioners have brought up the discussion about the recommendation for a $2 million annual allotment, which provides adequate funding for full-time staff and directed research, which the commission believes is necessary to accomplish its goals and objectives. This has been a new addition to the report, and a discussion was advised to discuss here today. The last two discussion points about the report is, one, to press the need for biographies from the different commissioners. Currently, we only have biographies from a couple of the commissioners, so I would strongly urge the commissioners who haven't yet given a biography to Rita to please give that as soon as possible. A paragraph or a page talking about the background and your biography would be great to add to the commission report at the very end. And then lastly, there will be a discussion, hopefully, about the spots that are currently available under the CD district of number 6, 7, 12, and 13, because right now their seats are vacant within the Los Angeles City Health Commission, and filling those spots would be a pressing concern for the commission. Those are all of the expressed topics that were given to me by the different commissioners, and we plan to talk about that right now.
Wonderful. I think, first of all, we owe a great deal of gratitude to Lauren for her superb job in putting together and pulling together this report. Three small comments. One is, for whichever commissioner felt it'd be better to be 2019 and 2020, I'm not sure it's already 2020, and we're not releasing it in 2019. I would just keep it the way it is, personally. We can discuss that. As for current objectives, I think we could just delete that. We don't necessarily need that in the report. It's a report of our opinions. We should discuss objectives here, but I don't think it necessarily needs to be in the report. And then lastly, reiterating what Lauren said about biographies, I think that we would have more gravitas to this report if the City Council and their staff could see that we are dedicated volunteers in what we do, so they can see the wide degree of diversity of presentation that we have. We bring different strengths, and that potentially that would have some impact on the staff of the City Council members that might be able to read this or will be reading it. Having said that, I open up to comments.
I'm
Please.
the commissioner that recommended the report 19-2020 because, and I'd appreciate information on this because I found much information and data references to 2019 in addition to 2020. So that's why I was recommending making it a 2019-2020 report. We don't have a 2019 report that I recall. Is that correct?
Well, we reported, our 2018 report was called 2018-19. We presented in 2019.
Okay.
So that's the only reason I didn't necessarily think we need to do it. I agree with you. I think you're 100% correct that this is reporting on much of what that was presented in data that is old. In science, oftentimes we're regularly in medicine quoting articles from previous years or from presentations from previous years. So I don't see a problem with that, but I'm open to a consensus for what the commission believes. If you feel strongly about it.
I was not aware that the 18 was 18-19.
the way we did that in a way to get it to the city council so that potentially the council and the committee on health would take it a little bit more seriously if it was more updated.
Okay. And I had another recommendation on the introduction page, page 1. It makes reference to the Los Angeles City Health Commission being authorized by ordinance to improve the health and wellness of the citizens. And actually, the ordinance says that the commission's purpose is to determine the health needs of the people of the city of Los Angeles, determine whether those needs are being met, and to help determine the best and most cost-effective ways of meeting these needs versus to improve the health and wellness. I think it's unrealistic for us to improve the health of Angelinos. And the ordinance actually reads differently.
It's always nice to be idealistic, though.
Yes.
So by reporting and studying it, theoretically, if we can get the city council to act, if we can get the state assembly or the governor to act by increasing Medi-Cal rates so that hospitals in LA City don't close, then theoretically we're going to be improving it. So, again, I don't feel that strongly about one word, but so if you do, I'm comfortable with it changing. But I think it's nice to reach for the stars and be a little bit idealistic and hope that we could improve it.
Or we could include, I just had a thought, what is stated in the ordinance and ended by, and thereby improve. Or
Sure.
there.
Yeah, no, I think that's reasonable.
Okay.
Any
That's
other
okay with
comments?
everyone else.
So I think we have the capability of approving this Health Commission report with those modifications that we've discussed. But I would love to get biographies added in as not as part of the report, but as an addendum and/or as an appendix to the report. I would also ask that, and I realize that you're dedicated volunteers and you're all very humble in your accomplishments. Now's not a time to be humble. I think that we're asking you to have an extensive biography that is with gravitas so that we could be taken seriously by the city council and by their staffs. So I would ask you to, for once, not to be humble, in writing at least. Is that reasonable?
Now, you know, I sent one in. It was about a paragraph, I believe. I just wondered how extensive, I mean, you know, we're talking about. I mean,
It could be a page.
huh?
It could be a page.
Well, all right. I could revisit it, I guess. I tried to just make the main points, I thought. I didn't realize we needed quite so much.
That's because you're so humble, and I appreciate
Yeah, I know.
that. But
I mean, I'm old and I've lived a long time and I've done a lot of things, but I didn't put them all down.
make believe it's a Wikipedia page,
Oh, all right.
so it could be extensive. I think one of the problems the commission has had is we haven't been taken seriously by many council offices as well as their staffs, and I think that one of our goals should really be to have the city council take us seriously, to give us funding so we could do serious scientific research so that we can have a true impact and improve the health care of the city of Los Angeles, and to have a commission report that's actually read by all 15 council offices as well as the controller as well as the mayor's office. That would be another nice goal. I'm not sure that that's happened in the past. I know several members of the city council personally have read it, but the definition of several is 2 to 7, and it's probably on the lower side of that number.
response from any of the city council offices on the previous reports?
Minimal. The kind of thing you would do to a third grade student, like, good job, we really like what you're doing.
Because we have recommendations in here that we would like to be pursued and acted on it. So hopefully this time we can encourage our council members to read and respond to us.
We're
each of
trying.
us.
We're going to try. We have in the past, and we'll continue to do so, and which is one of the reasons I would like to try to get this approved today, because ideally, if we did get it approved today, with the modifications that we've discussed, that it can go to the council offices and to the mayor, and then we could get time with the subcommittee that has oversight of health and present the report, but basically, again, asking for more support and for funding.
If it is approved today, when will it be forwarded to council? I'm asking because I feel like I would like to see it again before it's actually sent to council.
Sure, so we would approve it here on a vote with the modifications. The report would go out to every commissioner electronically. If there was issues, we can have that corrected before officially it's printed up and sent out.
Okay,
And we could easily do that.
okay.
Ideally, I'd like to have it done within 2 weeks, but if it was 3 weeks, it was 3 weeks.
Okay, that sounds good.
Does that seem reasonable?
I'd also like to comment that Commissioner Shannon also had some modifications for the report. She was planning to come today but was unable to attend, so her modifications and recommendations will also be accounted for as well.
I'd like to read those before they're put in. Yeah, I think if we can have those sent, her comments sent out to everyone, that would be nice. And I'd ask everyone to read them seriously and to, are we allowed to, by the Brown Act, to comment electronically or not?
If you're commenting to all commissioners, no. It would literally, if you had comments, you could send them to Rita, and Rita could, and then Rita could disseminate those comments, or
To Lauren?
Lauren. Yeah, but if you reply all, no. You'd have to singularly reply.
Okay.
And she's here.
We welcome Commissioner Shannon. We were just talking about your ears must have been burning. We were talking about your comments that you've made that we haven't seen, and we know you can catch your breath for a second, but we were wondering if you would want to point those out. So what we're trying to do is to vote on the report and have it approved today with the modifications that were acceptable to a consensus or the majority of the commission today.
Sure, and I apologize for being late. There was an
It's
accident on
not-
the freeway. And then I
Don't
took a wrong
apologize.
turn. Yeah, so the major change that I had was under Housing for Health. Actually, it may have been just before that on the homelessness
Could you give us a page? Or
introduction, and I think it's on page 2 or 3. So let me just find it really quickly. Yeah, so on page 2, first paragraph, it states 56% of homeowners spend over 30% of their income on rent, and that actually needs to be changed to renters instead of homeowners. It's not homeowners, it's renters. That was the main change that I had. So that's down. Line 10, it starts at the end of the sentence, or the end of the line.
correct. So it's true that homeowners also spend a significant amount of their money.
Right, but that would be on
On real-
mortgages as
Correct.
opposed
No, I
to
got you.
rent.
You're 100% correct. Right, so that should say 50% of renters is a correct. And I don't think we necessarily have to address the fact that significant numbers of people in Los Angeles City homeowners also spend a significant percentage of their income. That we could, if we had the actual data on that, the most updated data, that'd be nice to put in there as a second line. If that's acceptable to everyone else, because there are a lot of people who own their home or own a condo that are spending more than 50% of their income on, mortgage, insurance, et cetera. If it's not too hard, Lauren, that'd be nice to add.
I can add those statistics, and thank you for the sharp analysis of the word vocabulary.
Thank you, Susie. Was there anything else that you wanted to? that you felt-
Yeah, I think, so on page 3, under Housing for Health, where it states that the funding stems from the flexible subsidized housing pool, if we could add stems in part, because the money, so the flexible subsidized housing pool money comes from private entities, like the Hilton Foundation, along with the county, and now Prop HHH is part of that funding. So if we could say in part, I don't disagree with the sentence or the statement, but if we could say in part, because it's not, all the money for Housing for Health doesn't come from the flexible subsidized housing pool, if that makes sense.
Definitely.
That seems to be reasonable and acceptable.
Sorry, I'm having trouble with my phone now.
They're probably commenting also on the report.
Okay, so those were 2 changes that I had.
Lauren, do you remember any other changes that Commissioner Shannon had sent you?
She had just brought up the topic of adding one factual change. I think it was those factual changes that she was pertaining to.
Which was the renters.
Any other commissioners have any other comments or concerns about the report?
I wonder if it would be okay if we added the bill number so under background, under Housing for Health background on page 3, when it says second paragraph, down from the green highlighted area where it says background, second paragraph, it says, in 2016, California was established as a housing first state by Governor Jerry Brown based on evidence of the housing first one. If we could say, it was actually by SB 1380. So it was Senate Bill 1380, and the governor did sign it, but I know because I drafted that bill. So if we could just add that, so if somebody needs to go back and reference it, they'll know that it's that bill.
That's reasonable, makes sense.
I forgot to mention that there was also a recommendation to separate the report based on subsection instead of having them continue on page by page. So for example, if you turn to page 9, there is a continuation of the different subsections. So there was a recommendation to place them on separate pages for clarification and easy access to read. Does the commission think that this is a good modification to press forward?
I'm sorry, I don't understand. What does that mean, actually? That
The different subsections are prior to page 9 are on separate pages because each subsection ends reasonably at the end of a page, but because certain subsections go over in pages, they list right after, so they're not on separate pages. Would the commission prefer to have each subsection on their own separate page instead of on the same page, or would they prefer what is in the report right now and have them continuously one after the other be reported.
Oh, I see. So on page 9, veteran homelessness would not be like continuous. It would just be on the next, it would start on the next page.
Yes, that
Oh,
has
that's
been
great.
the previous model of our reports, but a recommendation was made by a commissioner to separate them for easy ability to read.
So the balance would be, one, it does allow people to look at each individual point on its own, which is laudatory. On the other hand, depending on how many are printed, we're destroying a number of
Paper,
trees, and
yeah.
environmentally, there's a negative there, too. Do we have an idea how many of these are actually printed? Is it only 30 or 40, or is it more?
I'm not really sure how many were printed last time. I imagine that you'd have one printed for every one of the council members, the mayor, the commissioners, and I'm not sure who else it would go to aside from the, the committee would be, they would all
Okay.
have one.
Most of it's electronic. Most of it's sent out electronically anyway.
Right, anything that is transmitted to the committee will be done electronically. So if you, do you remember if you provided hard copies to the members of the city council, or?
We did.
We did.
Okay.
Yeah.
So we do the same. So you have 15, the mayor 16.
Okay.
And then if this body wants a hard copy, we would do that as well.
I think we could do that. I think we can, for those numbers of pages, it's all recycled paper anyway, so we're not really having that adverse. I think it does allow each subsection to stand on its own weight. I think we could do that unless there's objection from other people on the commission. I think we could do that.
Yeah, because the printed version would be, because of how they print it, it would be 4 pages. So I'm guessing having its own subsection would just kick into a page, so it likely wouldn't even be
Right.
creating like more paper needed for that.
Okay. That makes sense. Great. Other comments that would strengthen the report?
When we give them a report, is it like this, or we put it in a folder or a binder of some kind? What do we do to make it look?
No,
It's,
it's pretty minimalistic.
yeah, when we had them printed last time, it was like a glossy front cover folded over. I can bring copies for you guys because I think I have a few left. Yeah, it's just glossy, and it'll be like bound.
Right, bound, okay.
And then, yeah, so it'll look like a real report.
Yeah.
Right, okay.
Wonderful. All right. Seeing no other comments, with those modifications, I would ask for a vote for approval. Can I get somebody to make a motion?
I make
So
a
moved.
motion that we approve it with the modification.
Do I have a second?
Second.
Second.
Any further discussion?
Oh, yeah. Here. This is what it looks like.
Seeing no further,
I just have a recommendation in the printing, since we did reference LA County putting a bid in for St. Vincent's.
correct?
Right, that we have a copy printed for each Board of Supervisor as well.
I think that's a wise. So with that recommendation as well, all in favor of approving the report with the modifications discussed, say aye.
Aye.
Any opposed? Any abstentions? It's unanimously approved. Lauren, you did an amazing job. We truly appreciate your work on this and your dedication to the people of the city of Los Angeles. And we relieve you so you can go to class now.
Thank you.
Do not underestimate how grateful that we are and the city of Los Angeles is for all your hard work. Thank you.
Yes, thank you.
Item number 2, seeing no other public comments in regards to item number 2, we've, in front of you all is, and been sent out earlier, is a running attendance since the beginning of the commission, which documents how often people have come, how often prior commissioners have not come, and also the vacancies that we've chronically had. We're still trying to get a full complement of commissioners. I have had email exchange with Councilman Rue's office, specifically asking for help, as he's the chair of the subcommittee on health, and have offered suggestions to them that would include having Chairman Rue use his leverage with the council members who haven't nominated someone to really ask them to bring someone up. If they don't, within a 3-month period of time, to either have it come back to us where we submit resumes to those council members to nominate somebody, and then we would have to change the city ordinance. But if a 3-month period of time had gone by and there was no nomination from a city council office, that this commission could appoint individuals. So each, we'd have 15 members, and we'd have dedicated people who really wanted to volunteer and be here. Questions?
Would that require a change in the bylaws?
It would change the city ordinance, so I don't think it would have to change the bylaws, but because the bylaws is more about our governance and not the city's or the council's governance. I don't think it would require a bylaws change.
Any comment from our city attorney?
Lauren had asked me a question. Can you repeat that, please?
So the question was, if the ordinance was changed to allow, if there was no appointee from a commissioner for 3 months, that this commission could self-appoint. If that was approved by the city council or in an ordinance change, would we then have to change our bylaws?
I have this issue come up from another group. The answer would be yes. You would change. You'd put in your bylaws that should, in a sense, you could, if you get approval for it, you could have as the city council can nominate someone for the seat, and if they don't within a certain period of time, in a sense, this commission could have, and you'd have to get this approved by the city council, but this commission could have sort of an alternate in the wings. So in a sense, there'd be 2. And if somebody didn't come, and you'd be able to appoint the alternate. If they didn't come 3 times, there'd be an alternate that you could step in. It would need to be approved by city council. So in a sense, you'd have a backup approved by this.
Yeah, I'm not sure that would work. We haven't hard enough time getting a full complement of commissioners, let alone getting 15 alternates. I think that's going to be even more difficult. Let's hope that our allies in Councilman Rue's office can get the chiefs of staffs of the 4 council districts that have not been compliant to step up and give us nominations, and potentially we could send them resumes of individuals, which we've done before, but we can keep on doing that on a regular basis. Let's hopefully that the current ordinance will work and we can get some nominations from those 4 seats. The other thing is we've done a very good job of actually having great attendance from those of us that are here today with making commitment to come here. So, it's open for conversation, but if we have 10 or 11 people showing up with good discussion, we're meeting the needs of the city, so maybe this is not a big issue. Susie?
I was wondering, do we know who, for council district 6 and 7, 12 and 13, do we know who the council members are?
So I think it's Martinez, Rodriguez, Lee, and O'Farrell.
Okay.
Can I make a correction on this?
Sure.
On that first page, 2015, it has both the former council member Bill Rosenthal and I on the commission, but can you cross me out in 2015 because I was appointed to replace Bill Rosenthal in 2016 when he became ill, so I wasn't on the commission in 2015.
Yes, sorry about that.
Okay, thank you.
Any other comments? Please.
Also, can I be excused for the last 2 absences since I had surgery?
Sure. Well,
Thank you.
the we're not excusing people for absences, and we're not making any judgments. I'll publicly say, Susie, that you've been dedicated to this commission from even before it was created, and have done a great job helping to try to improve it all along the way. And the city of Los Angeles should thank you as well for all your hard work. So we're not trying to make this punitive. We're really more of to see if there's issues with people who don't want to actively partake as commissioners and or council seats that aren't taking us seriously. Clearly, that is the latter is the case. I think now, with this complement of commissioners, everybody here is dedicated and trying to come as much as possible. So I think that those of us that have missed a meeting for other conflict, whether it be surgical or other professional or family-oriented, we accept that. So, but I think right now we have a great group of commissioners, and I thank you all for coming and doing what you've done.
And we have to remember it's an election year for the even numbered council people. So, like with Rue, he's got to continue.
Right.
For us to go to the commission to talk with them.
That's correct.
The committee.
The other thing is, from my reading of the ordinance, and I'd asked the city attorney at this, is if there are certain seats where the commission has been set, but a new council member comes in, does the current sitting commissioner carry over through the new term until a new person is appointed? That's my understanding, but I'll defer to your legal expertise.
As far as I'm aware, that is the case. And then obviously the new city council person can choose someone else at that time, but I believe it does carry over. That would halt a lot of commissions, a lot of committees in the city if that was the case.
Good.
So as far as I'm aware, that your analysis is correct.
Okay, that's wonderful. All right. If I could ask, Rita, if you could email me the 4 chiefs of staffs of the of the current vacancies, and I'll put it on my tickler file to regularly remind them that we're still looking, and we're more than willing to send them resumes of people that we know would actively partake and represent the entire city, but specifically give attention to their council district as well, if they're having a hard time finding their own.
Yeah, and I've drafted a letter that you can use, so I'll send that to you as a draft to take a look at and edit, and we can put it together to send to each one of those council offices on behalf of the commission, if you'd like.
I would like that, but if you don't mind, if you could just send one out now from your office to them on behalf of the entire commission.
I'll confirm. I did talk about that with the senior legislative assistant, and he felt that it should come from the commission, but I'll talk to the next person up and see how they feel about that.
Well, we can. Are we allowed to vote on that today? Approving a letter to go to the 4?
No, because the letter hasn't been circulated. It wasn't agendized. So you could discuss it, but not vote on it. The action item, it would need to have been in the agenda. In a sense, is if you're just.
But a letter can come from one or two of us independently, or not? From the president and the 2 vice presidents?
As long as, I mean, is it a,
It's a letter just asking for the city council offices that have vacancies to do the job.
yes, I mean, it's not coming for the full commission. If it's just you on, as the president, sure. You
Okay.
can go ahead and do that.
Then maybe instead of making an agenda item and tying us up, that I'll just do that and follow it up with either multiple emails and or phone calls, or emails and phone calls. Any other comment about vacancies? Great. Seeing no public comment on item number 3, items for future discussion. Susan?
Well, I think the obvious is coronavirus. I think if we could have somebody come and speak to us just on the current situation, if it's still sort of an issue, particularly for California or for LA.
Yeah, I don't think we should get somebody who's going to talk not just about coronavirus, but I think that maybe get an epidemiologist from the county public health who's in charge of viral transmission, because the issue of coronavirus is significant, but this is going to be a regular problem with a city that has 4 million people and a county of 10 million people that has more international travel than most cities in America. And in fact, LAX has more individuals who land at LAX and depart than any other major airport in America, which is one of the reasons there's so much traffic around LAX for those of you that live near it. But having said that, because of that, we are actually a gateway to Asia. In most of the RNA viruses start in Asia for a lot of different reasons. So I think that maybe getting a virologist or somebody from the county, that would be a good thing. It's probably a chief viral epidemiologist for the county that we could probably find.
You know, if I may, it might be interesting to hear a little bit more about the plans for St. Vincent's Hospital, because the county and the city are both making overtures about acquiring it, using it for housing and so on. So at some juncture, it would be useful to hear more about that.
Yeah, and an update on, and it may be the same person coming, on what's going on with the LA County Hospital. Because we had a presentation from Hilda Solis's office with plans for turning that into services and some temporary housing for a homeless community, and it doesn't seem like anything's moving or happening. And that's just empty property. There's a big Sears building too, that's just empty property that's languishing while we have almost 60,000 people who are homeless in the county.
I think there's, according to the LA Times, if I recall, there's 600 properties owned by the city of Los Angeles that are currently not being used. Now, some of them are not as large as those properties you just mentioned, but I think the fact that there's property that's already owned that's not being utilized is a big issue, and that is clearly a public health issue. So maybe we should get a report on that. The other thing that we haven't had a report follow up is from the petroleum gas administrator for the city, that potentially we can get another presentation there. The other thing is the issue and it's amazing in creating this report, Lauren and I have attempted to find anybody in either Sacramento, Oshpod, or the city that is a strategic planner who knows the right number of hospital beds that we need or should have in the city of Los Angeles, and could not find one person who could give us an answer or a report that has been done, which is remarkable. There must be somebody at the county that's doing strategic planning that has this information. So I think that would be another thing is how many beds does the city of Los Angeles need? And the last thing that we came across in looking at some of the statistics and some of the presentations that have been given to us in the last 3 years, oftentimes people refer to data based upon the county data. It also amazes me that the largest city in the state of California, that the state and the county instead has their own way of looking at the demographics and doesn't look at the city. I realize that there are small cities in the state of California that it wouldn't necessarily be prudent for the state to do planning or analysis of it. But nowadays with supercomputing, they're collecting all the data by zip code or whatever else. One would think that it would be a very easy software fix to just plug it in for a city with 4 million people.
They each tend to have their own district set up, or census tracts, which can also be confusing, but you're right. You should be able to meld those together and come up with something that counts it by other things. You could do it by council district, or, pick a denominator, I guess, as to what you want to do it.
Right. The county analyzes it by planning districts.
Right, they have a set of districts, right, but they don't overlap with other things, or they do overlap, but they overlap in a way that makes it hard to.
But I think that's archaic, and it amazes me, and that's another thing that nobody in the county system, not to look at Shamika, but nobody in the county system has thought about the fact that with 4 million people, the city of Los Angeles ought to have its own planning districts, that, as opposed to having the current planning districts as the way they've been devised. But again, I don't mind them keeping their little planning districts the way it is, but once the data has been collected, you would think it'd be an easy software fix to crunch the numbers and spit it out. Perhaps we can get or request the chief administrator of Department of Health Services of the county to come and present also to us.
Well, it would be useful maybe to have somebody from their epidemiology component or something come and talk about that issue of how you take a look at health data in a community within the county, because, as you point out, they're counting it by their system now, and that doesn't always coincide.
Well, let's see if we can work on that. Susie, do you look like you had another comment?
Yeah. Well, I just wanted to point out, LASA, when they do their homeless count, breaks up by city. So, I mean, they have done it. It's just, not for a lot of the health-related issues that we talk about. So,
we know there's a pretty large division of strategic planning for the Department of Health Services for the County of Los Angeles. One would think that one of those people could crunch data for us for the city, or figure out a relatively easy fix to get their computer analysis to put together all the different analyses based by the census tracts. One would think. Any other issues that people want to discuss?
I was going to say, if we had someone, go back to what we were talking about with housing, is maybe important to have someone explain the reasoning behind having so many empty available properties, and a lot of it is red tape and things that it needs to be brought up to code, and other issues surrounding that, but it'd be nice to see the reasons behind that and what it would take to make those properties available for homelessness or increased housing. There's got to be somebody in the city who...
Is there an ad hoc homeless commission that's been set up?
There's a committee.
No.
There's an LA City committee.
Well, there's
Yeah,
LASA.
No. So there's a committee within the LA City Council. It's homelessness and poverty.
Right.
But, There is also a commission, well, there's Affordable Housing Commission, there's a few other commissions within HCID. I mean, I could look into if, what crosses over. I know that they have an Affordable Housing Commission at HCID. I'm not sure if that's a subject.
So it might be a little bit redundant. I mean, I understand, Matt, where you're coming from, and it makes sense, but it might be redundant that other people are really charged with that. And we're more looking at homelessness as a cause of health issues and vice versa. I don't want to overtax people who should be presenting to other committees or commissions, but if you feel strongly, we can try to get them as well.
No, I think if we want to talk about, whoever comes to talk about the homeless housing portion of it should have insight into those issues too. If we're having somebody from that arena come in to talk to us. If not, you don't feel like it's important. I feel like one of the issues is finding more homes for homeless folks, right?
Yeah.
So we need to find out what the limitations of actually finding housing in the city is. Is that realistic? It might be, it might not be. So then there would be other places you'd have to look if that is not realistic. So if we say, hey, well, where's all these are all 60 empty properties or whatever, 600 empty properties or whatever it is that even realistic to consider as something we would even present to anybody to say, hey, you have all these options, why aren't you taking them or not? You know what I mean?
Yeah.
Right, so I think the city basically should have a plan on vacant properties if they don't already. So the Homelessness and Poverty Committee within the LA City Council would be under their purview. So if you want, I know a couple council members who are on that committee, so I could ask them where they are in the process, and then maybe they could have one of their staffers come and present to us and let us know where they are. But I think it's also good because if we're asking that question, we could kind of be the squeaky wheel that's prompting them. Like, we really need to know like what's happening. And I'm guessing that this would mainly be for adaptive reuse of properties that are already existing. There are lots of residential properties, like there's one at Sunset and Gordon. It's 299 units of rental housing that has been empty since 2013. So it's just things like that that I'd love to hear, like what the actual plan is from the city. And then we could maybe prompt them to create a report.
The other thing, I think we know that there's a lot of federally qualified health centers in the city of Los Angeles, or that see patients from the city of Los Angeles. There is an association that is presented here previously, I think 3 years ago, of community clinics and federally qualified health centers. Perhaps it'd be time to go back to them and have them come and present with us also what their up-to-date data is, how many patients are being seen, how many total clinics there are, what their total budgets are. They're probably collecting that data easily. They could probably be able to present that. It's not insignificant, the impact and the percentage of Los Angelinos that are being treated in federally qualified health centers and community clinics. It's a probably 40–50% of the population has some impact on that or some relationship to those clinics. It's a big number.
I can get our president of the Clinic Association to plan to do a presentation if you like.
Yeah, that'd be wonderful if you ever could.
Or one of the staff from the
Yeah,
association.
if she could do it, that'd be fantastic. And the 3-4 things that I would ask is one is the most recent data that they have on the total number of clinics, the total number of patients seen in the most up-to-date fiscal year that they have, and then a breakdown of revenue streams that potentially they have. For example, Saban Community Clinic, 40% of their their patients have no revenue streams, they're totally seen for free, then they're not Medi-Cal qualified, or they're undocumented and not eligible for Medi-Cal, at least previously. So it's significant, whereas other clinics, like the Eisner Clinic, they only have 2% that have no revenue stream. So it's a different patient mix and different demographic. It'd be interesting to see if they have data on that for the other health centers that exist. I did an analysis of this about 12 years ago, so it's outdated, but at that time, 795,000 individuals were seen in the county at one of the health centers. That's a big number. My bet is it's more now because of the expansion of the health centers, the expansion of the ACA, putting people into Medi-Cal through Covered California. And the last time I saw some data, 50% of the people in the county of Los Angeles are in Medi-Cal. I would think it's a little higher in this city, but I don't know the most recent data. Do you know, Matt?
It's a little bit higher. Most FQHCs now have lower rates of non-insured versus insured, because now most FQHCs see about 1 to 2% uninsured versus with no insurance versus all Medi-Cal for the most part.
Right.
So,
Right.
yeah, it's bigger.
The other thing is that, and I think we should publicly acknowledge that statistically, when government analyzes insurance, they consider Medi-Cal insurance. I think that's really not a true fact. Medi-Cal is access to health care. It's not really insurance, though. And it's a little dishonest to really incorporate that in the insured population as opposed to a necessary entitlement or a necessary need for the community to service people, but it's not really insurance. Sometimes they subcontract, the state subcontracts with insurers to provide that service, but
It's all managed, yeah.
yeah, it's managed. Two-thirds of Medicaid nationwide is now managed care. I think it's higher in the county or the state of California, but I don't know those numbers offhand. Anybody else know those numbers? No? It's a big number.
80% are managed.
Yeah, it's a big number. Yeah, yeah. Any other ideas? Seeing none, I ask for a motion for adjournment.
Second.
All in favor of adjournment?
Aye.
Anybody opposed? Any abstentions? Seeing none, we're adjourned. Thank you for your time and effort, and thank you for coming downtown and fighting the traffic.
Sorry about that.
No, it took me an hour to get here, and it normally takes me 20 minutes, so